Hello, this is a presentation for the Bill and Melinda Gates Foundation regarding maternal mortality in African American women in the United States from the perspective of a health educator, Abby Graham. So, what is the problem? The problem is of a racial disparity which affects African American women experiencing much higher rates of maternal mortality than their Caucasian peers. So African Americans are experiencing about 3 times the likelihood of maternal death from childbirth. Um, Interestingly, these rates have declined in the Caucasian population, yet steadily increased over the past decade in African American women in the United States. So why is this increasing for African American women? And what is the population? So the population is pregnant African American women of childbearing age. And educational, economic status, and health insurance do not statistically seem to affect the rates of maternal mortality among this population. Neither does rural or urban living, so that kind of gives an indicator that it's possibly not access to healthcare services or clinics as much as other factors. So that kind of leaves us with racism in healthcare being a likely cause. So women who experience racism in healthcare, which is at their healthcare appointment, um, during pregnancy are less likely to have follow-up care. And pre and postnatal care is a significant factor in affecting maternal mortality rates. So the socio-ecological model. Um, so we have some factors that help or hinder on different levels, such as the individual, interpersonal, organizational, community, and policy levels. Um, so what hurts this population? So obviously, we just discussed racism, um, poor quality of care, poor follow-up care. Um, these are all factors, inaccessibility to certain healthcare procedures, um, all negatively affect this community. What does help? Social support, education, having women aware of this racial disparity so they can, speak up against racism during their appointments, as well as continue and find a provider to increase the prenatal and postnatal care. And on the individual level, the presence of comorbidities such as high BMI, diabetes, smoking, blood pressure, these all raise the maternal mortality risk. So women should be aware of their specific factors affecting their health. So I have 3 different interventions that we could use to reach this population and hopefully reduce maternal mortality rates. The first is to provide support groups to pregnant women. This would be heavily promoted to African American women in order to reach this target demographic because they're experiencing the highest rates of maternal mortality. And the groups would contain small groups of women at the same gestational age, and they would be given health assessment, support, educational resources, um, as well as training by nurses or healthcare providers so they can take and interpret their own health data, such as blood pressure and weight. And then if they need to meet with a medical professional, it's available as well. Evidence-based intervention 2 would provide home visits to women and children and families, increasing child well-being, developing parenting skills, improving maternal health outcomes, mostly educating, providing health care to women if needed. Women can seek help in their home from nurses, social workers, community health workers, really depending on the issues deemed that they have, whether it be more family issues or parenting problems or mediating, fights, or whether it be health issues that they need a nurse for. So that can really tailor to the women. So evidence-based intervention 3. This is similar to the first intervention, except that we're not teaching the health outcomes of taking blood pressure, but it is supporting cultural but women are providing social support, giving advice, creating a social network, which has been shown effective um, in reducing maternal mortality for this population. So it's women of color supporting other women of color during prenatal and postnatal times. So women can also, and this Sister Friends group can suggest medical care or help if the women need it. This support group. So how will the interventions be evaluated and what means success? For evidence-based program 1, the ability of women to measure their health markers such as blood pressure and weight will be assessed pre and post intervention. This gives us a way of deeming success, which is if women can in fact successfully take your blood pressure and weight, and if there's been an increase in the rate that they can do this. Measuring this is just kind of, making sure that we hit targets from the intervention. And for the second program, determining how often the home care visits were performed. So again, meeting targets designed to get us to successful points, such as the reduction in the negative health effects and maternal death in the population. So improving the odds of health and success for this population in this study. The third intervention, we would be measuring the women that participated in the support groups and taking attendance to ensure or gauge the follow-up. So again, just seeing if the markers were met to set them up for the success. So if only a few women are going to support groups, or they are just making one support group, it's less likely that we're not adhering to the program. So success would be earlier medical attention to health problems, women are getting the care that they need, and provided education. So some barriers and challenges. One issue is of participant dropout and compliance, as like I was mentioning. Let's say 3 women just go to a support group and then they only make 1 out of 10 visits. So that's really not adhering to the program. So a solution to this would be educating women as to how important healthcare is in prenatal times and providing low or free cost healthcare services to them. Coming to women's homes, providing low cost care, reducing the financial barrier and providing disincentive. So another issue is funding insufficiencies. In order to provide these workers, staff, nurses, hospitals, clinics, we need to have adequate resources. Designing the program to tailor to this is important. Collaborating with hospitals, clinics to get low cost healthcare services as well. So the inputs, activities, outputs, outcomes, and impact of our logic model. We have, if we have these workers and salaries and inputs doing these activities, which are the home visits, the healthcare, workers, and then we are actually adhering to the program, hitting the markers, having women be able to successfully take weight, take blood pressure, then it will result in these outcomes, earlier medical attention, etc., and then hopefully, reducing the overall maternal mortality rate in this population. So thank you for listening, and I hope this presentation brought an understanding to the importance and need to reach this population and reduce the maternal mortality rate of African American women in the United States. Thank you.